Hi, I am Dr. Darabi from Darabi Dermatology in Chaska, Minnesota. As a Mohs and skin cancer surgeon, I see and treat many patients with skin cancer. I would like to talk to you about one of the most serious skin cancers, or even most serious human cancers, period, melanoma. Melanoma is a cancer of melanocytes, the pigment-producing cells in our skin, hair, iris, and retina of our eyes. Melanoma, like most skin cancers, is mostly caused by UV radiation of the skin, causing DNA damage in the cells of our skin, which then could lead to cancer. People at risk for melanoma are fair-skinned individuals, people with extensive sun exposure over a long period of time, and people with several sunburns. People with 50 or more moles, especially if they look unusual, for example, like the back of this person, or if a previous mole biopsy showed a mole to be abnormal or atypical, such as this example. We call these biopsy-proven abnormal moles dysplastic moles. A personal history of previous skin cancers or precancers of the skin, a family history of melanoma in a close relative, and immunosuppressed patients, for example, transplant patients who take immune-suppressing drugs to prevent transplant rejection by their immune system, or patients with leukemia or lymphoma. A strong family history or personal history of internal cancers, especially cancers of the pancreas, bladder, kidney, GI, such as colon, breast, mesothelioma, or astrocytoma. What can melanoma look like? The problem is melanoma can look very variable. Therefore, if you think something doesn't look right on your skin, get it checked out by a dermatologist because melanoma in early stages is curable with a simple removal with local numbing. The variability of the appearance of melanoma is the reason for the expression, "When in doubt, cut it out." Most melanomas are brown or black in color and look like an ugly duckling mole, meaning a mole that doesn't resemble the person's other normal moles, such as this melanoma on the calf, or this one on the ear. Sometimes they aren't as obvious, like this early melanoma, or instead of being brown, they can have other colors, such as this one that's red, or they can in unusual locations like the sole of the foot, the eyelid, or the genitals, or even the nail. A famous victim of nail melanoma is the reggae musician Bob Marley. The good news is, most melanomas are diagnosed very early and are curable with a simple, wider re-excision under local numbing, and have an excellent long-term prognosis. Here you can see the 5-year survival of early stage 1 of melanoma is close to 100%. This graph shows declining 5-year survival rates the more advanced the melanoma is at the time of diagnosis, with the worst survival of 15% after 5 years in the case of advanced stage 4 melanoma that had already spread to internal organs at the time of diagnosis. That's why it's so important to get your skin checked by a healthcare provider who is knowledgeable about melanoma, ideally a dermatologist, so it can be diagnosed very early and it can be easily cured with a simple excision. At Darabi Dermatology in Chaska, MN, we specialize in skin cancer and provide complete skin examinations where our patients change into a gown and we examine their moles head to toe. You can schedule an appointment with nurse practitioner Kendall Zeidler or myself, Dr. Darabi, on our website at darabidermatology.com, where you see our appointment availability, or you can call us at 952-395-6850. We are looking forward to seeing you soon in our beautiful Chaska location.